I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this.
And discrimination. Good afternoon, Namibia, and welcome to the COVID-19 Communication Center, your one-way stop of all things and everything COVID-related. My name is Manga Libita, and I'll be your moderator this afternoon. Before we go into our topic, we will ask our Honorable Deputy Minister of Health and Social Services, Dr. Muinyangwe, just to give us an update on what is the news this afternoon.
Good afternoon again.
Good afternoon.
Thank you, moderator of proceedings. The update remains the same as this morning. We are still standing at 16 confirmed cases, of which 8 have recovered, and we still have 8 active cases, which are also reported to be very stable and doing very well clinically. This morning there was a question of what are the strategies and approaches from the side of the ministry? What is it that we are doing as a country that for the past 20 days or so, we still stand at 16. And I'm trying to answer that question as well. I think we acted very fast as a country because, as we can recall, on the 17th of March, the head of state, His Excellency Dr. Hage Geingob, declared a state of emergency. And I think that was three days after our first case was confirmed. And then after the state of emergency, 10 days after, I think, because on the 27th of March, then we went into lockdown in the 2 regions, Khomas and Erongo, which also included Okahanja and Riopoth. Now, I think that was what we did excellent. We didn't wait too long. After the first 2 cases were confirmed, immediately a state of emergency was declared, and then we had our lockdown. Now, after the lockdown was introduced or pronounced, all the entry points and borders were also closed for both local and international travels. Then we also came up with mandatory quarantine facilities where all people who travel back to Namibia were put into quarantine. So as soon as they arrived in the country, they put into quarantine facilities where they were serving 14 days. Then we also had very strict isolation and monitoring of the confirmed cases. They were constantly being monitored. Then there was also very strict contact tracing and screening. So everyone who was in contact with someone who have been traveling somewhere or to high-risk countries were also traced so that they could be screened. it's good to mention that all the 16 cases that we have were either people who have traveled or people who had contact risk countries. Transmission. And of course, according to the WHO protocols, we also have started with testing, which is ongoing, and a very aggressive campaign, mass campaign, where information were disseminated. It is still ongoing, and I think the opening or the launching of the center, the media center, also contributed to information dissemination. So lastly, one also want to thank our Namibians who really are trying their level best to adhere to the lockdown guidelines. Because I think if people did not adhere to that, we could have, have many cases by now. But the lockdown the no new cases is an indication that somehow the lockdown has been very effective, is working very well. And also, I don't want to forget our health and medical staff who are working 24/7, who are, at the forefront and trying their level best to manage the cases that we have. And now we are listening to stigma and discrimination. Of course, we know that COVID-19 is a new disease, but we know that discrimination and stigmatization has been, linked to any infectious disease. So even with this one, although we know that it's dangerous and so on, discrimination is when we have prejudices and we are acting, unlawfully against some people, calling them names and so on. Even if we don't know much the origin of the virus, one already have started hearing people calling it that is Wuhan disease, is China disease and so on. And you even get calls from people saying that please from China because they might be infected. That is a form of and stigmatization also. And even people working here, because when you go home, you hear people saying that before you enter the house, please wash your hands, take off the shoes. So that is also another form of discrimination. And our health workers, as we are saying that, they are also family members, and they are already being seen as, you are carrying coronavirus, so there's no way that we can be in touch with our own family members. So there is a lot of discrimination that is happening in many different forms and at different levels. So we are looking forward to listen to our panelists. Thank you very much.
Thank you so much, Honorable Deputy Minister. And now just to introduce the panelists, we have got Dr. Lahia Hamunyela, a psychiatrist. We have got Johanna Theophilus, social worker. And then we have Krista Hansen, also a social worker. As we said, the topic today is stigma and discrimination. Maybe let's start by just asking, what is social stigma and what causes it?
Okay.
Johanna?
Thank you so much for the opportunity, Mrs. Chair. Stigma and discrimination is actually a broader circumstance which is used in various situations depending on that moment. But today we will focus on stigma and discrimination towards the health workers and also the community at large. When we talk about stigma in a context of health, we actually refer to a negative association of a person or a group of people that may or certainly have similar characteristics or shares the same disease. In view of this, we will have to bear in mind that This particular group of people or person is actually being labeled, discriminated against, stereotyped, as well as lost their social status in the community as a result of the perceived link towards this particular virus or COVID-19. Let me give you one practical example. We had a family which was in a house quarantine, of which one of the family members was said to have been in contact with a person suspected to have COVID-19. Now, after the quarantine date has been well administered to, and the health professionals has also tapped in and did their medical results, and everything came out negative. When the family members then started doing their usual daily activities within their confined environment, it turned out that the passerbys, some of them will stop and take pictures of this particular house, take pictures of the kids playing outside, and some will walk by and sanitize the air. Some will start calling them names like the Deputy Minister earlier said. They were called Wuhan sick people, they were called China sick people, they were called macaroni. So all these types of labeling has actually impacted a psychological effect towards this particular family. Like we said, stigma is actually has a long-term effect. And on this note, the social workers were dispatched in order for them to render the psychosocial and therapeutic services to this particular family, just to restore the dignities of these families.
Thank you. Dr. Amnya, do you want to add something?
Yes, I would like to add, as she said, it's rightfully what the society is labeling. Now, what we have to take cognizance is the labeling that we are putting out to these people or the particular family might be founded in, so there might be a truth to it that this person has indeed contracted the COVID-19, or it can be just the assumption that the person is associated with somebody who had contact of having diagnosed with COVID. Now the stigma, what happens with the stigma is that because we are labeling the person or the family, we actually discriminate or isolate them. Now, because we are isolating them by labeling, sometimes the people themselves also withdraw so that they do not go to seek the medical help that is needed at the right time. Sometimes they delay because they are afraid of what is going to be labeled. And I like the example that she used. She says the family. Then the society, then mistakenly we took the pictures, and what do? We put it on social media, and we definitely put a name and an address, and therefore we isolate these people. And we don't know the impact and the effect it has on these people. Because now we're putting three things on them. We have labeled them, we have mislabeled them, we have refused them from medical care. Now, because of the isolation, also they develop other underlying mental illnesses because of the isolation.
Thank you so much. Okay, today we are going to do things differently. At this hour, we will watch an earlier clip, a message from one of the nurses in one of the isolation units.
Sauruma, I'm here for corona epidemic, not even an epidemic, but it's a pandemic. We are here now, fight for a long time now. It's nearly a month and some weeks. So we are just here for the community to fight against COVID-19. We left our houses, our families, our whatsoever, everything of us, then we come to stay here. It's like an isolation, but we appreciate our Minister of Health to provide us with everything, food, and whatever we need, together with our patients. So whether the time we are going home, whether people are going to appreciate us or maybe to accept us, or maybe they are going to run away. If you can hear the messages and what the messages are sending, when are you coming back healthy? We are scared of you and all those things. Some are saying, no, come back, stop up to there. Some of our colleagues are even, because if I can remember, our first colleague went back home already because of the family saying, no, come out. It's very dangerous, you will die. But we are here now for the month. We are not sick, we are healthy, like them at home. We are even better than them because we are protecting ourselves. And they wanted us to stop. Then we say, no, we can't stop in the middle because you see, the whole country, Namibia, it's like a soldiers. Soldiers are protecting their countries. If they are told the enemy is somewhere there, they can't run away. They go and face that enemy. They are facing this enemy, the COVID-19. Okay. Up to the end. Okay. Okay.
Thank you so much.
Mr.
I
Olum.
think. Sorry. Thank you so much. I think that gave us an idea, the fears that the nurses are facing. If I listened well, she mentioned we are not sure how our families will react. Will they run away? Now, Krista, impact of social stigma.
The impact of it drives people away to seek for medical help because you are afraid that you will be stigmatized as a person that has the coronavirus. Or the impact might also be that it will discourage someone to show behaviorals that is positive. Or it might be that it will prevent someone to go to seek for medical help because you are now afraid. If you even come to a health, are they healthy? Are the medical staff or the doctor? And for me to go there, will I not contract the virus? So those are all the stigmas that is thrown to the people that they suspect they have the virus. So that's the impact of stigma.
Johanna, you wanted to add?
Coming on to what my colleague says, and I also like the presentation of the health worker because she's really conveying a very positive and strong message to the community out there. We also have to remember that stigma itself also hampers the response of people or persons. It may hamper you from reaching out to what you're supposed to reach out because of the stigma that has been fueled out from the community, your neighbors, or people close to you. And one other thing that we also need to consider is that when stigma is around a person, it's like there's a speaking block that is created before you, that you cannot see the light beyond this particular block. And also, you have to bear in mind that stigma does not only rest in this particular client or patient per se, but it also hampers the response of the caregivers, the family members, friends that cares about this particular person.
Okay, I would like to go back on that. I appreciate, and I would like to affirm the healthcare worker that was on the TV, on the screen right now. The important thing is that stigma itself stems from lack of information, lack of the correct. COVID-19 is new disease. We don't know more about it. So what do we need to do? We need, as a country, is that to collect our own information that is based on where are we standing at the moment with COVID? Why are we standing at number 16, rightfully like the Honorable said when we started? And then the important thing is the health workers, when they went there, they are supposed, or the social worker on the ground is supposed to be in constant contact with the family members to say, look, this is your family member. They went into isolation or quarantine the rest of the country. But the information that you need to know is that the person is okay. How long will they be there? What are the precautions measures that are taken so that they don't fall ill? What is it that we as a country are doing so that they recover? And we need to assure the family that, yes, the possibility is there that the person can contract COVID-19, but does that mean the person is going to die because of COVID-19? Possibility is there, possibility is not there, because we are taking a lot of precautions and we have acted very early. So therefore, when we have our own evidence-based practice medicine on COVID-19, then we can even overcome the stigma that is associated with that, and we empower the families and the society outside.
And one would really ask that, how do we address this? How do we do it? Because the fear is in both family and the nurses are scared that I go home, maybe Habi will say, it's enough, go to your COVID-19, you know. So how do we address social stigma?
Okay, would you like me to go first?
One of the points that I always tell people is that the community should build trust in health services. Because when we start listening to too many informations, that's what we start believing in, and we know exactly that negative information is bound to overpower the positive ones in most instances. And on this note, we would also like to inform the community that, stigma can only be addressed to us when we develop a positive side of this whole COVID-19. And on a third note is that COVID-19 does not discriminate, and it should not be attached to any ethnicity or location.
Yes, and the thing is also, how do you build this trust in the society? Is that your healthcare workers need proper training. If you have trained your healthcare workers to give the correct treatment, even identifying, tracing, the society itself will gain the trust in your health workers. Now, we are saying that, yes, some of us have taken already the oath, and it's called a Hippocratic oath for a reason. And medicine is an evolving science, so we need to be reading it every time. So when I am treating, I also have particularly to be trained on how to dress when I'm taking a sample. And then how do I take this sample? How do I do counseling, pre, post, and during? And also the fear in this person, we have to actually be using a lot of our psychosocial group to give counseling and to follow up also. Build coping mechanism in these people, resistance. We need to look at, then after that, what do you do? Do we just drop the person once they have recovered, or we also follow them up?
What I will add on is, as my colleague has said, trust is the thing. Yes, COVID-19 is new for us all, and when something is new, we just want to kind of shifting the blame to someone else. But trusting the health workers will be a very important aspect when it comes to protection of the health workers, protection of the community, and protecting the family from which the health worker is coming out.
I think it's not only health workers. Was it last night I listened to a police officer airing the same sentiment of fear? How do we, what message should we get across? someone like me to understand that you do not have to fear. I know information has been given. What more should be done?
You know, like as you are saying, when we are saying first respondent, we are not only referring to healthcare workers. Police are also always on the front line because you don't know what you're going to meet out there. So now, when we are giving information, I appreciate the fact that, yes, we do come on medias like TV and radios, but then the important thing is also, how do I reach out to somebody who does not speak English? So do I translate this information in a language that somebody understands? I don't have to use scientific words. It has to be simple in that you explain exactly why is it, for example, why is it called COVID-19? You have to start from there. You know, you start with COVID-19, why is it COVID? What is a virus? Why is it called a virus? Why is it a disease? And what does the 19 stands for? Because it began in 2019. So then you explain that, okay, that is why it is like that. What are the symptoms? Simple symptoms. If you are having these symptoms, how do you go for help? If you have fear yourself, how do you overcome your fears? Who do you consult? And then also important thing is the social media that we are saying. Obviously, there's a lot of information out there, but you need to discern to say which one is true, which one is not true. Which one do I forward, and why should I forward to whom? Because you're creating more fear in this person, and that fear will hamper the person to actually go look for help and actually understand that sometimes they have the fear, but they are not ill. Sometimes they are ill, but they have the fear, and then we have to deal with both.
Well, Namibians, if you have any fears, the toll-free number is there. All languages, 24/7, you can call. The number is 0800 100 100. Can I have questions from our journalists? Anyone with a question? Do we only have one? And please make your questions brief, to the point, and at least only 2 questions. Please ask your question.
Good afternoon. Thank you very much. My name is Ogito Greg. I'm a journalist. I write for Republican newspaper. It's part of the NMH group. You were talking as members of the panel about the importance of trust, but especially at public health institutions, there is a tradition of lack of helpfulness, especially with frontline staff, the people one must interact with to begin with. And that does not inspire trust. What action has been taken by the ministry to improve the reception that people receive when approaching public health institutions for help? Thank you very much.
Thank you. Any other question? Okay, maybe we can address that question. Dr. Lahia,
Yes,
you want to take a shot?
I can answer that gladly. Remember I said that it being a new disease, the training itself is also new to all the practitioners, to healthcare workers, yeah? Frontline is that we have various people who were how to take specimens, in how to give the information, and that is how we are cascading it down to including all the cleaners also. It's not only us as health workers. Another thing you have to take into consideration is also personalities. We all have different personality. However, like we say, we have a person that you can complain about what you have encountered. But what I appreciate is like even the place where we are now is like they keep giving information on a regular basis. So the information that was originally there at the beginning is totally different as compared to where we are today, because we are working hand in hand with WHO and the standards of how can we improve based on what other countries have experienced, and particularly what we are experiencing in our country.
Thank you.
Yes.
Thank you so much. Okay, at this moment we are going for a commercial break. I told you we are going to do things differently today. So we'll be back in a minute.
We good?
We continue with our discussion on stigma and
Discrimination.
welcome back. We continue with our discussion on discrimination, stigma and discrimination on COVID-19. Now, let's go to the do's and don'ts, if there are any do's in stigma, in social stigma.
Yes, and don'ts. It is good to talk about the COVID-19, but it is not good to talk about someone that you suspect cases. It is also not good to follow rumors, because right now where we are with COVID-19, most of the people will make up stories, send to each other, and you will see that on social media, which is not good. Yes, we can talk about people who has contracted the virus. We can talk about the treatment that is there.
Thank you. Our lines are now open for callers to call in. The number is 061 400 397. 061 400 397. You can call in. Okay, we continue with do's.
Well, some of the don'ts is that let's not dwell too much on stigma in terms of COVID-19. Like I've mentioned, we shouldn't attach it to a COVID-19 is not it's not a China virus, it's not a Wuhan virus, neither is it an Asian virus. The reason why the officials had deliberately put on, emphasize on the name COVID-19 is actually to avoid or stop people from fueling stigma within the society or communities.
Thank you so much.
Yes, I think we should avoid the language. The language that we use should actually be person-centered. So we should actually say, like my colleagues say, a person who was diagnosed with COVID-19, a person who has recovered from COVID-19, and also the information that we put out in society or community, we should also act very ethical and professional that we don't If the moment you name, we are labeling this person. And if we put the person in front, we are actually putting dignity and humanity on that. But if we remove that to say the person with, then we are dehumanizing this person and we are removing all the rights that they had.
Thank you so much. Just something that came to my mind. It may not be related to COVID-19. I had the opportunity of listening to one dynamic young man who told us that he have heard several times the media, journalists, people referring to people as people living with AIDS, people living with albinism, people living with disability. And he told us, I quote, a person living with albinism, I'm living with my mother. With a person with albinism. So please, let's take, all that boils to we try to find, names and labels, but did we ask permission? It was very clear. He does not live with albinism. He lives with his mother.
Like my colleague said earlier, we should actually avoid using such terms used by the chairperson. We should consider saying it's either a person presumptive for COVID-19 or a person actually who may have COVID-19. These are the polite and pleasant ways, because it doesn't put the next person on a spot to say, you live with COVID. Or somebody else may interpret it differently, exactly the same way that the chairperson have just mentioned.
Okay.
So
we have a caller on the line. Jonas, ask your question, please.
Right, ma'am, I have heard you talking about discrimination and stigma. But my question is, when I have looked at the privilege given to the people from 18 years old up with regard to 750, I have seen that there is a stigma with regard to the children from 0 up to 17. What really went wrong there? That they are not given that privilege. Are they not having the right like others? They should, leave it there.
Okay. He is asking people 0 to 17. It looks like the grant was just given to 18 up. Now he's asking, is this not discrimination that 0 to 17 were not given this grant? Did I hear you well, Jonas? Is that what you asked? Yeah, that was the question. Do you have any take on that? He's asking, is that not discriminating against the 0 to 17 years old? Honorable Deputy Minister will answer this for us.
Was it Jonas?
Yes.
I will try to answer the question from Jonas. But before I come to that question, I also want to say something about discrimination and as my colleague said, it's because it's a new disease and people don't have the right information, so which means that people need to be educated. Something that comes up, people need to be educated in order for them to be that knowledge so that they can start understanding. If people understand the complexity and the dynamics of the disease, it will help them also to have a better understanding and to have less discriminatory attitude against other people. Now, to come back to the question of also not discrimination to give the 750 to people from 80 up, from between 18 and 59. That's the question. I'm trying to answer that question of 0 to 17. These are children, isn't it? Are under the protection and they are responsibilities of their parents. When you are above 18, you are expected to take care of yourself. And because you cannot, under these circumstances, that's why the government then tried to assist. Because in any normal circumstances, we will not help an adult who is supposed to take care of himself or herself. But a child who is 10 or 15 years old is still under the responsibility of his or her parents. I think that could have been the rationale where the Ministry of Finance then tried to say we are only helping those who are in normal circumstances, would have taken care of themselves.
Okay, we have another caller, Haldilu from Ocho. Hello?
Yes, hello.
Yes.
I just have a question for a panelist. I just wanted to find out, like now, if a person is diagnosed with with COVID-19, do they give support in terms of psychological support to the entire family and the person in particular, or how does that go in terms of psychological support? Because it's a new disease and so much information is flowing here and there. You know, it needs really a strong mind in that regard. So how does the ministry deal with that case?
Thank you so much. Did you get the question?
Yes, I got that. So it's a very good question. What is in progress now is that at national level, we have a psychosocial group. This psychosocial group means that a lot of social workers, so they're the ones that are at the front line at that particular. They screen the patient or the person who has been diagnosed or suspected with COVID-19, and then they then channel it to mental health unit. Okay, now mental health unit, particularly for the government, it's us that are there, psychiatrists, psychologists also. But at the moment, we also have the private psychologists that are on board. So therefore, they also have a roster or a timetable that says, for example, on Monday, who is on call. And then, but on a regular basis for mental health, we have the psychologists and the psychiatrists that are on call. So we process that, and then we also give counseling to the family and the individual that.
Joanna?
On the part of the social workers' intervention is that, like Dr. said earlier, we have a number of social workers. Usually attach social workers to a certain family. Say, in the case of the caller, we attach a social worker to a certain family. And based on the needs presented, not only the side services, but there might be other needs also that this particular family may present. So it's on this note that the social workers then intervened within this particular process to render their services to the client.
Okay, we have another caller, Domino from Mariental. Hello, Domino?
Hello, ma'am?
Yes.
Good afternoon.
Good afternoon to you.
All right. I would like to pose my two questions. They are just a little bit related. My first question is, it seems like Namibia did not find that much of these infected people, but I'm not sure if I'm under correction. But my question is, if it's because the numbers are rising maybe from our neighboring countries and also in our own country, so which means blocking our movement and everything, so including the economic empowerment, also, let me say, with everything, education. So my question is, what is the government's plan from now? Because if they say the lockdown must be on, nobody can move, and then because of spreading this disease now at the borders, as with this total we have, we're sitting there. If they're rising, which means what is what is the impact there? What's the cause of rising the numbers of the infected people? Because if it's that the border is locked, and we're spreading this through the countries. And the second question is, it's not, the second question is, I just want to know.
Domino?
Yeah, because, hello?
Hello, Domino, can you just repeat your first question?
All right.
This time, no longer statements, just the question, please.
All right. My first question was, the border are locked to defend the spread of this COVID-19 in increasing in the countries or in areas. So I'm asking, if it's rising, where is it rising? Because if it's low, and why can't what's the plan of the government to reduce this COVID if it's increasing? That's my question first.
Okay, what is rising? Where is the number rising? In Namibia?
In South Africa, our neighboring. So what I was saying is that if it's reduced here in Namibia, and maybe they are not willing to open the blockation of the areas region to region because of the spreading. That's what I was asking. That why should it be if the number are reducing and later on the number are increasing? What's the cause? That's my question.
Thank you for that question. And your second question?
My second question is it's about education. Because of the school are locked, and I see there's no way. Like now, we are almost approaching the 5th month. So, what I want to know is, should they repeat or should they start over next year?
So much, Domino. I'm not sure if the panel that is here is able to answer both your questions, but what we'll do, we'll note it down. The education part, we'll also take it to the relevant authority, and I'm sure they will come back as of now. For now, it's not for the panelists. Okay, where were we? I think now let's come to taking into account the message we got from the health worker, from the nurse out there. Something that they will not forget.
What I will tell the community is, where we are as health workers, the frontline workers, as you said, we are taking care. People working at the quarantine is, when we come back, give us love, accept us. We know anxiety can be. It doesn't mean now that we are working at the health facilities, we will. The only thing we want from our community members is just give us love and accept us. We are yours. We are in together in this COVID-19.
Okay, for the community, I would say that we have to remember that, and we are the community. So therefore, if a family or an individual, a healthcare worker for that matter, has been diagnosed and recovered, in touch with them on a daily basis, just to ask how has this impacted on you? And as we are discriminating or stigmatizing, what is it that you need? Can I offer? Because most of the cases, if we are not supporting the healthcare workers, we are the ones that are driving them, end of the day, to end up with a mental illness, or for that matter, commit suicide and live with aggression and anger and hatred. And we don't want to do that. Because we also need that also in retrospect.
Thank you so much. We have another caller, Vaino from Rundu. Hello, can you hear me?
Hello?
Yes, please go ahead.
Yes, my question is simple. It's not really a question, just a motivation. Like, things in Namibia, we have been exposed. We went to things we come up with cases, and then we are going to the end now, almost to the end of the lockdown. what measures were being put on the table in order, even it's a week, we are not going to observe and to prevent our activities in the country to go well until too close to other borders from other countries, only to be operated inside our country. That are the things which were also coming to the community, because community is really there behind the information. Not all of them, they are well about this COVID-19. And the people whom are going to be educate the communities, health workers, they must be well equipped for nice explanation to the community. And then the community to become to the point of understanding. Because otherwise, if it's the community, they will miss out some information. It will be worse. That is what I'm trying to debate to the Ministry of Health when they will send to the health workers in the community. There are some people who are deliver. They've been talented that there's some people, they know things, but they have poor in delivering service to the community. That is, we have to look at that measure also carefully. That is my contribution.
Thank you so much for the contribution. We take note of that.
Well, I should actually extend my gratitude to the Namibian nation positively towards the fight of COVID-19. On this note, I would like to urge the community to kindly remain positive, call for help, call for toll-free number for help, and also try and be in contact with your families if need arises.
Just a question, if someone was at home with all these fears and what have you, can they call the toll-free from our social workers?
Yes, like the Deputy Minister I mentioned earlier about this toll-free number, it is 24 hours on, and it is there to respond to the needs or the questions of the community in different languages. So anyone that may has a situation or uncertainty about this COVID-19 is free to call in any time to get the relevant information in regards to COVID-19.
Thank you. So, and the number is?
The toll-free number is 0800-100-100. I repeat again, 0-100-100.
Thank you so much. Any other questions? Do we have questions? Is that it? Okay. We are doing things differently. In closing, may I humbly request for all of you to stand, and we applaud our health workers. Just to give them a clap of hands, please. Okay, thank you. Thank you so much. Thank you, and we come to the end of. Once again, just a reminder, if you can email, please email us at covid.ict.gov.na. And our toll-free number is 0800 100 100. 0800 100. Thank you so much.
and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this. Hi, I'm Anna, and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms,